Hello everyone. Today I am going to talk about metabolic syndrome, including who are at the risk of having metabolic syndrome, the cause of it, and what we can do to prevent and treat chronic diseases. The definition of metabolic syndrome according to National Heart, Lung and Blood Institute is that metabolic syndrome is a group of conditions that together raise your risk of coronary heart disease, diabetes, stroke, and other serious health problems. Metabolic syndrome is also called insulin resistance syndrome. To establish the prevalence of metabolic syndrome in the population, scientists first established an operational definition of the syndrome. A person has to have 3 or more of the following to be considered as having the syndrome: abdominal obesity, waist circumference 102 centimeters in men and 88 centimeters in women, hypertriglyceridemia 150 milligrams, low high density lipoprotein HDL cholesterol, high blood pressure 130/85 millimeter, high fasting blood glucose 100 milligram. Note that the double arrows indicate that each of the disorders can affect the others. Two potential interpretations of the double arrows include the following. The increased levels of inflammatory cytokines cause the insulin resistance that leads to the obesity and type 2 diabetes. The central obesity leads to an increase in inflammatory cytokines and FFA that, in turn, cause the insulin resistance. The other theory is that an elevated level of oxidative stress causes metabolic syndrome. The figure shows the complex interrelationships of the various metabolic disorders. The double arrows indicate that each disorder can affect the others, creating a complex web of causation. A large waistline is also called abdominal obesity or having an apple shape. Extra fat in your stomach area is a bigger risk factor for heart disease than extra fat in other parts of your body. If your blood pressure rises and stays high for a long time, it can damage your heart and blood vessels. High blood pressure can also cause plaque, a waxy substance, to build up your arteries. Plaque can cause heart and blood vessel diseases such as heart attack or stroke. High blood sugar levels can damage your blood vessels and raise your risk of getting blood clots. Blood clots can cause heart and blood vessel diseases. High blood triglycerides. Triglycerides are a type of fat found in your blood. High levels of triglycerides can raise your levels of LDL cholesterol or bad cholesterol, sometimes called bad cholesterol. This raises your risk of heart disease. Low HDL cholesterol, sometimes called good cholesterol. Blood cholesterol levels are important for heart health. Good HDL cholesterol can help remove bad LDL cholesterol from your blood vessels. Bad LDL cholesterol can cause plaque buildup in your blood vessels. Note: sometimes called the good cholesterol because it returns cholesterol to the liver for removal from the body. Cholesterol is a waxy, fat-like substance that is found in all the cells of the body. Note: LDL means low-density lipoprotein, and HDL means high-density lipoprotein. This figure provides some clear suggestions that make it a nice wrap-up of what we have just seen. There is a large body of evidence showing that endurance exercise training favorably affects a majority of the risk factors making up metabolic syndrome, with less support for resistance training. Not surprisingly, diet and exercise are the principal non-pharmacological interventions used to prevent and treat a variety of chronic diseases. In summary, the metabolic syndrome model describes connections between and among obesity, peripheral insulin resistance, hypertension, and dyslipidemia. Potential underlying causes of metabolic syndrome include a low-grade chronic inflammation and an increase in oxidative stress. Exercising, eating a healthy diet, and maintaining a healthy weight are strategies to both prevent and treat these chronic diseases. Thank you for listening. Remember, exercising, eating a healthy diet, and maintaining a healthy weight are strategies to both prevent and treat chronic diseases. Stay safe.